Bore Dalhow. It's such a I know it's overused, but it's such a privilege to be here today. I'm so excited about the title of this conference, because if anything is building the foundations, then it's what happens in the first 1,000 days. So my name is Liz Gregory. I am the Wales Development Lead for the Parent Infant Foundation. The role of the foundation is to promote the importance of parent-infant relationships, support the development of specialist teams, and bring the voice and perspective of babies to the foreground of policy and service delivery. Prior to this role, I was a consultant clinical psychologist working in children's mental health and psychological services. And I think it's fair to say that we've always tried to turn the dial towards early intervention and prevention, but when you're working in acute services, for any of you who've been in there, it's really, really hard to do. So when this job came up with the Parent Infant Foundation after I retired from my NHS role, I couldn't believe my luck that I would actually be only working in early intervention and prevention and the first 1,000 days. I tried to find that meme of that really excited little girl, like all my Christmases had come at once. And then I realised there's actually a photo of me pulling exactly that face when I was 7, with a guest appearance from a 70s collar there. So that gives my age away a little bit, if nothing else does. So yeah, can't believe that my luck, and can't believe, my luck that I've arrived at a time where it feels like lots of people are interested in this, and I can't work out if it's like the time when I got a yellow Mini and I looked around and everybody was driving a yellow Mini and we all used to wave at each other, or if actually pennies are starting to drop. And I think it was really, really exciting that of all the ministers here today, we had the mental health and wellbeing minister, and that it's an all-age mental health strategy, because it really recognises that the foundations, to coin a phrase, are laid down in the early years and in childhood and adolescence. And I think that connection in and of itself is really heartening and really hopeful. So people often ask, well, what is infant mental health? And it's a difficult concept to get your head around, and it's also quite a controversial concept for some. Can babies have mental health? And I kind of understand that if we think about how mental health has been used in our society, but if we think about the much broader definition that it was fantastic to hear Emily talking about, then hopefully it all starts to make a bit more sense. The Parent Infant Foundation has had a go at defining it. It describes a baby's capacity to experience, regulate and express emotions and form close and secure relationships. And of course they can only do that through their relationships and experiences. Babies come to the world with particular temperament, biology, health issues, whatever it might be. But in terms of how they learn about the world, it is through their relationships and through their experiences in the world. So this slide really sums that up. What surrounds us, shapes us, the work that public health are doing, and the frame that Emily shared reinforces this. And also, I suppose the most important thing is, and particularly for a room full of people working and interested in public health, it's the thing that we can change. It's the thing that we can influence. It's the thing that we've got most control over. So child development is shaped by a complex interaction of factors, both within and around the child. It's not simple. We can't, as again Emily was saying, it's really complicated, but we're learning more and more all of the time. And I think that what's particularly exciting is that, certainly we've been saying this in psychology for a very, very long time. It feels like more and more disciplines are coming together and saying the same things, and we're learning more and more about how it all connects. So that feels like a really exciting opportunity. And again, Emily's done a lot of my work for me, but the period of development during the first 1,000 days is so rapid. And of course, we've got the other period during adolescence that we're learning more about. But this is really when many influences can have an impact. And I suppose it's a unique opportunity of opportunity and vulnerability. So it's about, you know, how can we maximise the opportunity at the same time as minimising the risk and vulnerability. So that it's that double-edged approach that feels really, really important to take. And also, you know, we can help the babies that need it the most by intervening, but we could really help the ones who don't particularly need it by giving them more. So it's a win-win situation from my perspective, to really focus in on the first 1,000 days. And we know that the brain, its ability to change in response to experiences is much kind of more likely during this period of time. Of course, we never give up and we can still achieve change, but it gets harder and it takes more and more resources. So, you know, it feels like a no-brainer, certainly to me and certainly to lots of people, but we need to get that message out here again. And it's a shame, again, that the Minister wasn't able to stay, because I know her focus feels like it's on adolescents and schools, but really, if we start earlier, then that's the way that we're going to really impact that too. But we'll do our bit to get that message across. Sorry, I keep flicking. And yeah, it's that you know, this is an investment in babies so that their experience is better in the here and now, but it's also an investment in their future. And the range of impacts that supporting nurturing relationships early on have for society and for individuals and society down the line, it's really quite striking. This is a kind of simple diagram of it, illustrating years and years and various pieces of research, and it's in our commissioning toolkit just to help get the message across that it genuinely is an investment in the future, ranging from, you know, the quick wins like better speech and language for children going into early education, but also down the road safer parenting, better adult mental health, reduced violent offending. These are big societal issues that if we get the early start as good as we can, we're going to really make a difference and impact on. But it's a hard message to get across when those big hitters are the things that are demanding attention and resources. You know, obviously it kind of morally it's the right thing to do for babies moving into the future, but financially and economically it's the right thing to do as well. And this is the kind of Heckman curve from I think it's from Harvard, or I'm not sure where it's from, but anyway, it's much used, and I was thinking of getting it tattooed on my arm at one point. But it's the you know, it just shows the return on investment if you intervene early compared with later down the road. And we've known this for a long time. There's amassed 50 years of research that really supports this. So why is it that you know, it's taken so long and it's so difficult? And you know, again, it's about kind of recognising, particularly those of us who've worked in acute services, just how hard it is to turn your head when this is so demanding all of the time, and particularly at a time when resources are very scarce, when we're coming out of the impact of the pandemic. All of those things mean that the demands just really have our eye. If anybody's looking for a good summary of that research, then this is the one from Harvard. Sorry, that's the Harvard reference that I was talking about. It's a really good place to go, as a go-to for summing up really, as I say, years and years of research, and as I say, years of research that are now coming from different disciplines into one conclusion, which I think is really exciting. So yes, it's even reached the Royal Foundation. So some of you will be aware of the Shaping Us campaign that the Royal Foundation have just announced. It's a great framework. It really kind of talks about how the roots for future development is in babies in childhood. So I think, you know, when we're talking the same language as the Prince and Princess of Wales, then, you know, we've got to use that opportunity to make the most of it, particularly as we are from Wales. So I've talked a lot about the why, and I'm guessing in this audience, I'm not, I'm preaching to the converted, but I guess it's the next step is that, well, how and what do we do about it? So I guess, as I say, the foundations for flourishing are laid by strong and social emotional skills, all of which have their roots in early childhood, but continue to develop through our lives as we encounter new situations and experiences. And at the heart of that is attunement. It's attunement to a baby's needs. And this is just a very kind of simple breakdown of a very complex field. But the early interaction a baby's experience with their caregivers can very broadly fall into three categories. Attuned, and these interactions support all aspects of a child's development and well-being, as I was saying earlier. Adverse, which can hinder a child's development and well-being, and absent, which can inhibit a child's development and well-being. So, of course, our aspiration is for attuned interactions. And that's not to say that we can be attuned all of the time. And any of us who are parents or who have been around young babies know that that's not the case. But I guess the difference between these three is the intention to be attuned, the trying to be attuned, the working at it, and the message that gives the baby in that relationship. And this is a Dan Siegel quote: "Children need attunement to feel secure and to develop well, and throughout our lives we need attunement to feel close and connected." And as I was saying, it doesn't have to be all of the time at all. And I think there's some research that talks about, if you manage it 30% of the time, but that's not to say don't worry about the rest of the time. It's the intention and the effort that you put into that relationship that is the bit that makes the difference. And sometimes you hit and sometimes you miss. And of course, we know babies bring something to that equation too, and some babies are much trickier temperamentally or developmentally to attune with, and we've got to really hold that in mind, because this is a sensitive area for any parent who's struggling with these issues, and it's about that intention that we really need to focus in on. So, if we value our children, we must cherish their parents, and hopefully, that goes without saying. But I guess I'd take it a step further. If we value our children and parents, we must value and cherish the people who work with them. And I guess this is where, what we're really talking about is creating that kind of whole system approach where we're all, and it's fantastic that we've got a presentation from the around Neath Nest. And also, Emily, you were mentioning the trauma-informed approach. It's really, again, it feels like lots of things are coming together to say a similar thing, that we all benefit from nurturing and attuned relationships. And of course, babies and vulnerable babies benefit more, but we all benefit. And it's much easier for a parent who feels nurtured by the people around them to go on to be able to nurture their baby. So I guess at the heart of it is parent-infant relationships, and it's one of the key mechanisms that impact our lifelong outcomes. And I guess my role, it feels like pennies have dropped around adverse childhood experiences and around poverty. And again, we've had these mentioned earlier today. My role is to talk about just how important parent-infant relationships are in this, and how we want to think of them in a similar way in terms of the impact that they can have, both negative and positive. But I guess the gift that comes with parent-infant relationships is that the solution can be found within the problem, that supporting parents to do things a bit differently can make a huge difference. So, as I say, my role is lottery funded. It's for 3 years, and I kind of think about it as kind of 1,000 days, not quite, give or take. A bit of induction and a bit of settling at the end. But and I guess I find that really, really helpful, because one of the things about the first 1,000 days is kind of miss it and it's gone. And that's not to say there aren't opportunities to catch up at a later time. But if we really want to maximise what's happening for our babies, then we need to kind of recognise that each each delay is another cohort, and that feels like, you know, it feels so important to bring that sense of urgency to the table, I suppose. So in terms of how I think about my role, it's 3 days a week covering Wales, but I guess what I'm trying to do is to keep a plate spinning at every level, so to think about how we can influence national policy. So again, fantastic that we had the Mental Health and Wellbeing Minister here. We've done a lot of work to try and influence the mental health strategy, and we're there ready with ideas for the delivery plan at every opportunity. And so really kind of raising that profile at a national level, and again to have the support of Public Health Wales and the work that you're doing on developing the framework for early years, feels like there's a national drive there. And then we've got the regional strategy, and again, you know, the Neath Nest framework couldn't be more aligned to what we're trying to do here, and really kind of brings that whole system approach together. And I think one of the problems with parent-infant relationships is that it's really relevant to so many fields and areas of government, including, so, you know, obviously public health, obviously mental health, obviously social care, and obviously school readiness. But where does it sit and who drives it is one of the risks of something like that covers so many areas. And then we've got service delivery, and I'm doing lots of work, and it's fantastic to see some colleagues here from Cwmtaf Morgannwg who've done absolutely phenomenal work and have really garnered the whole system to work towards developing specialist support for parent-infant relationships. But also, I need to keep an eye on parent-infant co-production and the baby's perspective, and that's something that I'm really passionate about, and I'm delighted I'm working with a group of parents who are helping to steer my role, which feels really exciting and really important, and putting, you know, baby voice right at the heart of everything that we do. This is my niece Ellie when she was 4 weeks old, you know, a bit into my role if we're following her journey, because she's really running parallel to the 1,000 days, helpfully. I asked her parents permission if I could use this photograph, and then they said yes. And when I was putting the slides together, you know, it was before this presentation, a while back now, I thought, do you know, I haven't asked Ellie what she thinks about that and how she feels about that. And of course I can't ask her, but I can do more than just ask her parents. And so I went back to her mum and dad and said, you know, I'd like to use this, and this is the reason. And I'd like you to think about what Ellie would think about that, and if you think she would be okay with me using it. So it's a slight shift, and it's not perfect, but it's a step towards recognising that Ellie has opinions, points of view, they might be different to her parents, and I will revisit this with her and see if we got it right, and we might not have, and I have to take responsibility for that. But just a slight shift in how we think about her voice, and making sure that we shout that loud and clear, and that baby voice is at the heart of everything that we do. We didn't get a mention, but together with Children in Wales and Cwmtaf Morgannwg, we did put together a baby voice response to the mental health strategy consultation, and Sarah has referenced that before. So hopefully just having that will make a bit of a difference to how people think about it. So as I say, trying to work at all those levels and keep all those plates spinning, trying to influence the strategy where we can. And, you know, another part of that work is that we pull together the Golden Thread, which is a paper really pulling together all of the evidence, all of the rationale, but also putting forward some suggestions about how to develop parent-infant relationship work across all of the areas, recognising the complexity for government when it doesn't quite fit anywhere neatly. So offering ideas about what that might mean and how that could work, and pulling on how that is working across the UK, and also some really clear asks, including promoting baby voice, because I think if we start to think about babies as individuals from a baby's rights perspective, they are the one age group that don't have specialist mental health services, and we know that A, how important that period of development is, and B, how much a difference we can make if we intervene. And that in itself, from a children's rights perspective, is really concerning and alarming. So bringing that message home feels really important. So as I say, It's a difficult one because it's everybody, literally everybody's business and everybody's involved. So we've put together this flower, flourishing flower, to try and get that across, that parent-infant relationships are rooted in communities. Communities need to feel that families belong, that they have a place, and that they develop services that fit their unique needs. But it's also relevant to health, public health, the third sector and local authorities, education and social care. Our most vulnerable babies, I think babies are 8 times more likely to die at the hands of their parents than any other age group. It's really striking for those that are most vulnerable. And so what we're saying really, and that's why we use the golden thread, is that parent-infant relationships needs to wind through all of our work. So I have got a video here that I'm going to try and play.
Now,
yeah. Oh, that wasn't me. I pressed a button, but it wasn't me.
Okay. They need to work on that, right? Yes. Okay. Did you understand it though? No. Okay. All right. Huh? Oh no, not this one. This is the grand finale of this. Yeah, that's the last one. That's what I was wondering. I don't know what they're gonna do next season because they did some stuff this time. Exactly what I was thinking. Oh yeah. Right, don't bring that again. You know what I'm saying? Don't do the same stuff. You know what I'm saying? Yeah, I was thinking that. Yeah. Like go somewhere else with that, but don't break it here. You know what I'm saying? Yeah. That's what I said. It was like.
That's fine. Well, I think we've got. So just a gorgeous video that probably most of you have seen at some point because it went viral, it was so popular, but just shows that, this baby doesn't have language, can't say what he needs, but he's making his voice very heard. And what's lovely about it is the dad is so attuned to him and so, demonstrating that serve and return that is so important in those attuned relationships. I guess the message is that this is not rocket science. It's about slowing things down and really getting down to the level of babies and tuning into what they need. And it's not costly either, but it is time consuming and it does take time, and it means that we have to kind of slow everything down. Oops, can I flick to the next slide? Lovely. So I sometimes do this and I sometimes don't, but I think I'm going to, if that's okay. A lot of attunement is about losing your self-consciousness with babies. And so I'm going to be very, very brave myself, but I'm going to, hopefully, you will be brave too. I'm going to split the room in half and, nursery rhymes, stories, lots of baby things are about that serve and return and that ping and pong. So we're going to lose our self-consciousness and have a little sing. Okay, so this is Twinkle, Twinkle, Little Star. So we'll start here and then we'll go there. I'll do both. Okay. Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. Wasn't so difficult, was it? It was, yeah. But I suppose the point is, and I forgot the words there, babies don't care if you forget. It doesn't have to be perfect. It doesn't have to be in tune. It doesn't have to be good. Babies don't care. They just want you. They want you interacting with them, and it makes such a huge difference. So I suppose just to finish, because I know I'm on my time now, I really kind of helpfully went to a conference, and in fact Amy was there from Public Health Wales as well, in Cambridge by Pedal, and there was a speaker there from Harvard, and his interest really is about upskilling, outcomes for children in resource-poor communities. So he's done lots and lots of work on this, and looked at very, very resource-poor communities. We're talking about farming communities in China, and kind of pulled out the things that made the difference. And I'd really recommend people looking at his website, and I think Pedal have got a copy of his talk as well, and it's absolutely brilliant. And he showed a video clip of this farming community that have become a foster farming community with no training, no support, no curriculum, no nothing, but the outcomes for really disadvantage and lots of children with physical and mental disabilities and learning disabilities has been extraordinary. And what they've pulled out are some core themes that really align with the whole school approach that you were talking about, actually. The importance of connection, reciprocity, so that serve and return, inclusion, that sense of belonging, which really is heartening if that's the first step that's coming out of the research for the whole school approach, and opportunities to grow. And if you've got those core qualities in a setting, then children are going to thrive. And it's just such a heartening piece of research when we feel so overwhelmed by what can we do and how can we change things. And I guess the other thing, this slide is from my husband, actually, who's an engineer, and we don't often have anything in common with each other's careers, but his industry talks about turning the tanker and how hard that can be in the same way that we do. But the slide he uses is that it's, rather than thinking of it as a tanker, think about it as flotillas, and we're just trying to turn one little boat at a time, and eventually more and more will turn. And I have a sense that that's beginning to happen, which is really exciting. And here's my niece, a bit older. That was last summer, so she's grown again, and I'm keeping an eye on her as I look at what we're beginning to achieve for all of our babies during the first 1,000 days. And that's where I will finish. Thank you. Thank you.